You're live now.
All right, thanks.
Okay, great. Thanks, everybody. Welcome to Board of Health for the month of February. I hope everybody is doing well. We are waiting for a couple of our board members to join, so we are going to skip over some of our initial items here until we have them join us. I don't believe we have any members of the public for privilege of the floor either, so I'm going to go ahead and skip over that. I'm going to hold on approving our minutes until we have quorum. So I'll go ahead, Frank, and actually, is Brenda back?
She is not.
Okay, Frank, I'm going to go ahead and ask you to handle the financial summary, please.
Yeah, so we're still trying to figure out the end of last year. As you can imagine, it was an unusual year. The state did declare an imminent threat to public health, which allows us to claim 50% instead of 36% on state aidable actions. So we're working through that. We've also had to manage, FEMA says they're the payer of last resort. State aid says they're the payer of last resort. They can't both be the payer of last resort. So we're trying to work through that. And pretty much all of the county COVID expenses like testing and which is in the millions of dollars now, has gone through the health department budget. So Karen Johnson is working feverishly to try to figure this all out. I had to have a counseling, not a positive counseling session with her this morning to give her some support because she's pulling her hair out trying to figure it all out. But we'll have more concrete information in the next month or two about how the year closes out. But I think it's safe to say that this isn't going to be a traditional year as far as where the budget ends up. The county has told us they will make us whole on all of these COVID-19 expenses. So it really is more of a just a moving of the pieces around to make sure that it all lines up. We are also trying to do the state aid application for 2021, which is due shortly as well. And that they've told us not to include the imminent threat to public health increase. We also don't know what the state budget implications are going to be. So we're trying to put that puzzle together as well. But just know that Karen Johnson and the admin team are working diligently, and we'll have some finalized numbers in the next couple of months for last year, and then what we're projecting for this year.
Okay, great. Thanks, Frank. Questions from board members on that? All righty. Frank, can I give you the floor back again to provide your administrative update, please?
Sure. Just a couple of things on the disease front. Things are trending in the right direction. Seeing some single-digit days over the last week. I'd really like to see that active case number get under 100. I've been watching and hoping we're at about 130 right now, but that's good news. It's good news that we're trending in the right direction. We did see the spike from the holiday season. The numbers did go down in the community pretty much in line with the end of the holiday season, but of course that aligned with the returning of students. And so through the reentry programs, both at Cornell, Ithaca College, TC3, we did identify students returning that were positive, which did, elevate the numbers. We didn't see the decrease like we would have, absent those numbers. But thankfully, we were on the decline. So when those numbers came in, it didn't look like a big spike, which was good. And of course, all of our higher ed partners have been great with doing the entry testing, isolating and quarantining effectively. And we've not seen any significant spread from those reentry cases. There have been some spread through close contacts and others, but nothing, widespread into the community that we'd be concerned about. And that has really settled in. Cornell is back to green after having raised their level to yellow for a few weeks. So all in all, things are going well on the disease front. And we're also hearing from the state that they are beginning to relax some of the restrictions. So movie theaters and billiards halls, I think, were the newest thing today or this week. So it's moving in the right direction. That's all good news. On the vaccine front, we're vaccinating as quickly as we get them in. Cuyahoga Health Systems continues to be an amazing partner. Last week, there was some issues with the delivery because of the weather, but we were able to do the pop-up pod at BJM downtown, and we vaccinated 216 people there, many of which were seniors. So that was really good. And that was mostly health department staff. The hospital was there and was helping support, but the majority of the vaccinators, the majority of the registration folks, the majority of the flow control folks were health department folks. So that was really good. I appreciate everyone's effort to help with that. And it went really well. This week, we have received last week's allocation, came yesterday, and this week's allocation came today. So we have roughly 2,000 vaccines to give out, plus 600 plus second doses to do on Thursday. So we're planning for those now. Tomorrow, we're going to be doing the folks that were registered from last week. So the healthcare workers, some grocery workers, as well as Titus Tower and McGraw House with our comorbidity allocation. And then we're working on the rest of the doses and this week's doses for later in the week. So I have a meeting. I have to leave at 12:30 to go to meet with the hospital to plan for those additional doses. Just so you're aware, now the health department each week is getting an allocation for phase 1B workers and for comorbidities. So those are the two populations that they are allocating to the health department. The hospital is still getting a very small amount of 1A doses, and so we're continuing to partner with them to do it all together. So that's what we've been getting. A bit of news, this is kind of breaking news. We're hoping that either today or tomorrow we're going to be launching a registry. Which will allow people to tell us that they're interested in being vaccinated. It does not guarantee them a slot, but they will give us their name, address, email address, phone number, and they'll tell us which priority group they fit into. So as we continue to move forward, we'll have direct access to those individuals to give them registration links as we prioritize different groups, including the groups we haven't opened to yet, restaurant workers and those transportation for hire folks. So that I'm hoping it will go out today. We're just putting the finishing touches on it, but tomorrow at the latest, that should be out there. You can register for other people. So a family member could register if there's a senior that doesn't have access to the internet or such. And we're also working with 211 to be able to register people into the registry as well for those that don't have internet access. So, and they will tell us when they register that they don't have internet access. So when we make vaccine available to that group, we will know we would need to call them to get them registered. So that's the thing. We're working on that right now. And like I said, we'll hope to have it out either today or tomorrow.
And Frank, just before you move on from that, so is that going out as a public notification through your public notification system?
Yeah. Yep.
Okay. And then I had a second question related to some of the 1B groups, particularly for individuals who are under the age of 18, who are meeting some of those eligibility groups. So for example, some of the grocery store workers or dining workers, we just had some questions about how are they able, since they're under 18, are they able to register to get the vaccine, or how are they supposed to go about doing that?
So they have to have Pfizer if they're between 16 and 18.
Okay.
Because Moderna, the minimum age is 18. The place that where Pfizer is being made available is at the state sites.
Okay.
So that's really where they should be targeting their attempts to get an appointment, because the state is focusing Pfizer at those large scale sites, and the Moderna is coming to the health departments. Okay,
and then do they have to bring a parent or an adult with them, or a letter, or what happens when at the point of vaccination?
That is a good question. I don't know the answer to that. I do believe they would have to have parental consent if they're under 18.
Okay.
Frank, just another question on that. Do they at the state sites, do they need letters from their clinicians, or can they attest like you're letting Tompkins County people do?
Yeah, we haven't been able to get a solid answer to that. The state says no, they don't, but then when you register, it makes it seem like you do. At least is what I've heard. I haven't tried to register at a state site, obviously, but it wouldn't hurt. But I don't know that they have to. They could call the state hotline to see if they can get through there. But they really should look at what when they register for the Binghamton site or the state site, it should kind of tell them what's necessary.
Frank, I'd actually had heard from two different patients who both, one went to Syracuse, one went to Binghamton, and they were at, the one in Binghamton said they didn't need the letter from a medical provider anymore. So, but yet this one from Syracuse does. So I'm not understanding if they're in the midst of changing it or not. So.
Yeah, and the challenge with the state sites is we don't have a direct line into them to know what they're doing. So really the only answer is to call the state hotline and to try to get an answer there. But I would encourage folks to get an appointment and then try to call that 800 number to see, what the rules are for the site they're going to.
Sue?
Yeah, I wondered if there was any thoughts on including higher education, especially those who are doing face-to-face teaching in the teaching area. And then what about food pantry workers? Are they included with groceries?
So the higher education is in phase 1B, and it's actually the last population in 1B before we expand to restaurants and others that we haven't gotten to yet. We're hoping to put a significant dent in the PK through 12 this week. Because of the 2,000 doses total that we've received. So we should be able to put a significant portion of those out to PK through 12 this weekend. And then from there, we'll be able to move on to the other groups. So I can't guarantee that it'll be next week, but they are certainly in line as we move through our prioritization. And then what was the other question, Sue? I'm sorry.
Food pantry.
Food, yeah.
Food pantry. So technically no, but I would hope that either by age or comorbidity, many of the folks that work and or volunteer in a food pantry might be eligible at this point. But the actual working in a food pantry wasn't in the listing. We're still trying to effort that because Meals on Wheels is another one that we're trying to figure out. It's difficult because the criteria is not specific to every single instance, and we're still trying to figure out where those folks fit in. I can tell you we're doing our best to try to be as reasonable as possible. It's not my goal to not have people be vaccinated. We're just trying to make it as open and as available based on the supply that we have. But right now they are not included, but it doesn't mean that they will stay that way.
Frank, sorry, another question about vaccines. I heard from the volunteer coordinator that a lot of people aren't showing up for their second doses. What do we do with that vaccine?
So second doses have to go in second dose arms. If we had second dose drawn actually in the needle and we were in the 6-hour window and we absolutely can't find somebody, we then can ask to put it in a first dose arm. I think we've done that once of the almost 6,000 people we put second doses in. So we monitor very closely before we open a vial. As far as the unopened vials, we hold them and we use them for our next second dose clinic. So it's kind of a rolling bank of second dose vaccines where we don't yet have authority to use those for first dose clinics. We do have a thing on our website for folks that have missed their second dose appointment to put their information in. We've had that for a few weeks. If we have doses at a clinic, that's the first place we go to. And then when we open a second dose clinic, we're going to start trying to register those people into them. So we did that last week. We took the list and with the extra vaccine we had, we added in those people that had missed their appointments. So we are managing those second doses for second dose arms.
Okay, great. Thanks, Frank. Any other questions for Frank? Okay, Frank, did you have anything else? We interrupted your thought process.
No, I was done when you asked
Okay.
the question, Christina. I'm good. Thank you all.
Okay. Anything else? All right, and Frank is going to be leaving us a little bit early, just as a heads up for that vaccine meeting. So again, if we need him, now's the time to ask. So, okay. Our health promotion program is up next.
Hi, everyone. I am working with Frank on the public communication around vaccines. So that's most of what I've been doing. So I don't have much to add to the report. It's been good to work with Melissa and Samara on some thinking through community outreach and education about the vaccine as it progresses and as we hopefully get more vaccine that will be open to a wider portion of our population and how to navigate that. And then otherwise, I'll just put links in the chat here for the virtual office hours that are coming up tomorrow. There are 2 of them. One is for older adults with a physician, and the other is with a local physician who speaks Spanish, and the whole session will be moderated in Spanish. So those are available through our website and people can register. So if any of you can share those, that would be great. And then the videos for many of these office hours are available on the YouTube page for the county. And I'll also direct your attention to the COVID-19 town hall that Frank and county administration held last week. And that video is also available. So I'll put those in the chat. Thanks.
Great, thanks, Sam. Any questions for Sam? Comments? Yeah, Sue.
Yeah, just a comment. I think these were a great idea to have these office hours, and I just wondered if you got a lot of participants interested in joining on those.
Yeah, we've had good participation. I don't have the exact numbers. I think the first one had the most participation, and then the subsequent ones, some of them have been more for specific populations. So, but they've all had good participation. And again, the videos are available after the fact too, if folks can't make them. So they've been shared widely, and yeah, it's been really successful.
Okay, anything else? Okay, great. Let's go to Dr. Klaypak, Medical Director report.
Good afternoon. Nice to see everybody's face. So I'd like to go back, Christina, before we started the meeting, you were talking about the personal protective equipment and students and so on. And what I think what keeps me up at night and what has me most worried is about variants, about mutations in this virus. And fortunately, so far, no really bad news, although it's bad enough that the reproduction number for the UK variant and the South African variant and the Brazilian variant are all higher than what has been the predominant strain. This means that by March, it's predicted that the UK variant will be 50% of what we see. That means that the predominant strain, 50% and better, is going to be more transmissible than what we've been seeing. And that all just means you can't let up on masking, social distancing, all the rest of it. What keeps me up at night is worrying about whether we're going to find resistance to the vaccine. If that happens, then we're into a bit of time until we would have a better vaccine. So all the more reason that time is of the essence in terms of controlling the pandemic and stopping it. The more time, the more opportunity for mutation, the more opportunity for bad news to come our way. So this message, we can't hesitate to continue to sound, just as Frank and Samantha and all of the staff have been doing so well for so long. And even though we have COVID fatigue, the name of the game is stopping the pandemic, as you know. In my report, I had a piece on transmission, some data showing what age groups tend to contribute to transmission. And those of you in higher education will see that your age group is well represented. And that the predominant working class, working group of people between 20 and 50 are very well represented. So these are important groups for us to carry the message to very aggressively, to institute, maintain all those public health measures. I want to draw your attention as well to the fact that we are seeing cases come up that raise concern about infection after the first dose of vaccine and perhaps after the second dose of vaccine. Remember that you're not achieving 95% vaccine protection until 2 doses of vaccine, and you need to be down the road almost 2 weeks before you get there. If you've only had 1 dose, you're somewhere around 50% protected. That may fall off. We don't know as you get 3-4 weeks down the road till you get to that second booster dose. We have some concern there. As you know, it's 95% effective. That means 5% aren't protected. And that 5% can be an important factor for us. In our case investigations, still travel is a big factor. Travel still continues to be a big factor. People clustering or gathering still is a big factor. We saw that with Super Bowl Sunday. And so these kinds of higher risk behaviors continue to need to be emphasized. We are seeing, as I pointed out in my report, the guidelines are somewhat changing with regard to vaccination. I'm not clear on how much hand waving is going on with the change in guidelines. For example, with regard to whether you need to isolate if you've been vaccinated and you have an exposure. We did start vaccine generally in mid-December. So now we're down the road, January, February, 2 months for those people outside of the study groups, outside of the trial groups for the vaccines. We're down 2 months into their experience with the vaccine, somewhat less after the second dose of that vaccine. That's not a lot of time to collect a lot of data. We do have, of course, some data from following the people that were in the study groups for Moderna and Pfizer and looking at what's happening to those 30,000 people. But again, somewhat limited. Do we really know whether after you've been vaccinated that you totally don't need isolation and so on? A little bit of hand waving perhaps going on there. So it's important not to overemphasize the need to await data that is being studied and is being accumulated and that will come out as we go months and down the road, even a year or two. We're at a very unusual point with these vaccines. I cannot ever remember a vaccine coming out for usage where there hadn't been many more months of post-vaccination experience. That's a good thing because we needed this vaccine right now. We can't wait. The other vaccines were slowed down. There wasn't the upfront money to lower the financial risk and encourage the development. And so they naturally had to be drawn out over many, many more months. The downside of it is that we are going to be discovering information about the questions that I've alluded to already as we go forward. And we need to look for that information to come along. But on the flip side of that, I want to emphasize that as healthcare practitioners, as healthcare professionals, we should emphasize the positive. When we talk about these vaccines, I believe we need to be emphasizing that we do know a lot about these vaccines. We know the most important things about these vaccines. We know about their efficacy and we know about their safety. And we have a temptation, I think, as professionals to sometimes quickly go to talking about what we yet don't know. Do we need a booster shot? How many months or years will I be protected? Those are important questions, but they're not the most important questions. We know that these vaccines are safe. There are at least 5 ongoing surveillance programs looking at the experience with these vaccines in the people who have been vaccinated. And none of them have shown red flags. None of them have raised concerns. All of them have tended to corroborate what we knew from the vaccine trials. So we need to lead and emphasize the positive. We know these are efficacious vaccines. We know they're safe. We know that people should get them. The other questions, they do have relevance, but they're the fine points. And I don't think we can hesitate, and I think we can be in good conscience as professionals by emphasizing that these are good vaccines and we can go forward. The other point I would add is that these vaccines aren't just the product of the past year. The first mRNA vaccines were developed back in the SARS epidemic of 2003. And then along came MERS, and mRNA was further developed. So we know a lot about the mRNA vaccines from those experiences. They never had to be rolled out in general usage, but that was only because SARS tended to die of its own accord. It didn't have the communicability that COVID does. And MERS, of course, was a more regionalized kind of issue. So emphasize the positive, I would urge you. And hopefully we'll meet our vaccine goals in our community, in our state, and hopefully in our country.
Great, thank you so much for that. Any questions or comments? Okay, well, I've kind of been hoping the governor takes us up on the challenge to give us 10,000 vaccines a week and see what we do with it, because we would have Ithaca taken care of in, a month. So, okay. Next up is where am I? Division for Community Health. So
sorry, Christine, I actually do have a
Sure.
question.
Sorry.
I was wondering, Dr. Claypeck, is there any way that you might be able to send around like some talking points for elected officials? Because I think many of us have been asked about some of the concerns after the injections, and I would love to be able to present like some medical facts that come from your office and help us with the talking points.
Let me let me abstract out of the practitioner's bulletin I sent out last week, which
Okay.
had data from these from some of these surveillance programs that are going on, and also from the bulletin I'll be sending out later today, which talks a bit about some of the other issues I mentioned in terms of reasons why one can emphasize the positive. So if I sent it out to each of the board members, then perhaps you could route it farther on to legislators, Shauna?
That sounds great. Yeah, that way you don't have 14 legislators asking you for the same thing.
Okay, very good. I'd be glad to do that.
Okay, thank you so much.
Yeah.
Great, thank you. Anything else? Okay, Claire, you're up.
Hi, everyone. I'm in transit, so I'll be brief. I think Frank gave a great update on the COVID surveillance and disease management efforts. The community health service case investigations are going well. And I don't think I have anything further to add for the report.
Okay. Any
Are there
questions,
any questions?
comments for Claire? Okay. Deb, children with special healthcare needs.
Hi, everyone. The Children with Special Healthcare Needs Division has been paring down our work on COVID during the week, very happily working in our other programs. We still are helping a little bit as needed, but with the numbers being down, they haven't needed us as much Monday through Friday. We still are covering the weekends, and we've been helping out with some of the vaccine clinics, but things are going well.
Great, thanks, Deb. Any questions, comments for Deb? Okay, Jonathan.
Yeah, I do not have a report.
Okay, and Liz.
I don't, excuse me, I don't have anything to add to my report.
Okay, any questions for Liz on her report? Okay, and since Frank has left, I don't know that someone else has a CSB report right now. Just seeing, no, okay. So before we go ahead and conclude, can we go back to the approval of our January 26 minutes, since we do have a quorum here now? So can I get a motion from someone in a second? So I have a first from Melissa and a second from Ed to approve as written. Any discussion? Okay.
I actually
sure.
found one little thing. There's a comment I made about the Ivy League rules and sports, and it was connected with Ithaca College, not Cornell. The top of page 3. It said Ithaca College must abide by Ivy League rules, and they don't have to. It's Cornell.
Yeah, I think that was a discussion that I in response to my question I had posed, I believe. That might have been the comment, but it probably did. Yeah, it's probably incorrect. It probably should be Cornell.
Okay, are you able to make that adjustment? Okay, great. Okay, any other points for discussion? I didn't even catch that, so thank you, Sue. Okay, so it looks like all in favor of approval with that one correction. Opposed? And abstentions? Okay, Samara, did you want to have input on this? Because we can't see you. Oh, we have a yes. Okay, great. All right, any other new business for discussion? All right, folks, then we'll go ahead and move to adjourn here, and have a great February, and we'll see you in March. Bye-bye.
Thank you.